Hello, my name is Joyelle Mandy. Today I will be discussing two different scenarios in consultation dealing between a consultee and a consultant dealing with responses, the proper way to respond. My reference today will come directly from the Psychological Consultation and Collaboration Introduction to Theory and Practice by Dwayne Brown, Walter Przwanski, and Ann Schultz. So for the first scenario, it says that the consultee says, "This job is so stressful. I never imagined that managing a staff of 7 could be so draining. Everyone has different agendas. No one seems to realize that I can't please everyone all the time." The first consultant response is, "It sounds like you feel a lot of pressure to keep everyone happy, and no one seems to realize how hard it is." Consultant 2 says, just from talking to you for 10 minutes, I can see that you're not assertive enough and your employees have lost respect for you. I think one goal of our work together could be to help you become more assertive." So, to me, the best response is consultant number 1. The reason being is that consultant 2 sounds more critical. They start off well by saying, I've been talking to you for about 10 minutes, showing that they've been paying attention, but telling them, "I can see that you're not assertive enough and your employees have lost respect for you." One very important aspect in the consultant and consultee relationship is for the consultant to empower the consultee to problem solve and critically think for themselves by inserting themselves, by giving them necessarily the answer. That takes away an important part of the foundation for the consultee to learn that once they're on their own in the field, they really won't have someone all the time to tell them or pinpoint exactly what might be lacking. The consultant in number 1's response, they kind of more so garner around what's actually going on, how they feel, which is also key in the relationship. The consultant has to be able to empathize with the consultee and let them know that they understand how they feel, but also hold them to be accountable to how they feel as well. So as it says that they can tell, instead of making it seem that the consultee is doing a horrible job, that they are not doing enough, that people don't respect them, that people don't care for them, which is a huge no-no, because them being in the delicate position that they are, being a consultee, being the new kid on the block, also feeling that people don't respect them could put them at odds with the rest of the agency. It could put them at odds with their colleagues and other consultees that they have to work with day to day, and it lowers their confidence, and that's a huge struggle already in that position. So that type of answer rips away at their confidence, makes them feel insecure around their peers and partners, whereas the first consultant lets them know that they kind of think they know what the answer is, but it gives more of an opportunity for the consultee to open up and say, "Well, yes, I do feel that I am making everyone happy, but it's a lot of pressure." Or they say, "You know what, I think it's that, but also I've noticed so far that this is also making me feel." It's more conversational, it feels more safe, but it also gets to the point that there's something definitely more deeper going on that needs to be looked into and delved into, per se. So for the first scenario, consultant 1 would definitely be the best choice to go with. For the second scenario, it says the consultee expresses, "I'm really worried about Madison. She seems to cry too easily. I'm wondering if something is going on at home." So the first consultant says, "Tell me a little bit more about what you're saying," whereas the second consultant says, "What time is the next faculty meeting?" So which one would be more effective in this case would be consultant 1 once more. This being because again, going to start with consultant 2 as far as the criticism goes, is that consultant 2, they're more concerned about the next faculty meeting. This conversation is geared towards a concern that the consultee has. Within those sessions between the consultant and the consultee, there are definitely moments, especially because the consultee is still learning, where they become kind of an advocate or a concerned individual for their patients, because they're still learning how to feel, how to empathize without sympathizing, like all those different moldings that they're just now really getting to experience outside of their book work. And so for consultant number 2, them asking, when the next faculty meeting, it's completely brushing off the concern of the consultee. And the issue with that is because the consultee is not just concerned because of something they've observed, but they're concerned about their patient. They're also not just concerned about their patient, but they're also reaching out in a way of trying to figure out what could be the reason behind Madison crying so much. They're looking for help to kind of get a better understanding off of an observation that they've had one-on-one with their client. Consultant 1, once again, no pun intended, is the best answer because they're probing. They're not being aggressive. They're not being uncaring. They show concern for sure by asking them to, keep expressing what they've noticed. But more importantly, they're challenging the consultant, again, without being aggressive, to really think about the session, to really consider, the experience with their client, to really, think about what is it that they really notice, what cues, their body language, the dialogue, like what gave them that concept, what helped them to arrive to that observation, and what else in that observation could they notice that maybe they haven't slowed down to pick up. What a part of Madison's narrative, what a part of Madison's session with them helped them come to that conclusion. And then of course that also opens up and creates an opportunity for a deeper discussion to occur. It also creates possible goal setting by asking the consultant to go further and to investigate further in the moment with the consultee to speak with the consultant, because now the consultant has an opportunity to ask the consultee to maybe have a goal the next time that they meet with Madison. If there's something that they may not see connecting, the goal might be for them, which also is important, as also learned in the book, that it is essential for there to be a goal for them to reach. So it might be for them to say, the consultant to ask the consultee, well, tell me more about what you're seeing. The consultee might say a few things, name a couple things, and the consultant with their seasoned experience might notice that there's a little bit more that they could tap into. So again, it gives them an opportunity to set a goal for them. They might tell them, okay, next time you meet with Madison, mark when you notice that she's crying. See if there's a certain trigger or a certain cue within your questioning that brings on emotions that cause her to cry. But that's completely robbed with consultant number 2 because it's completely bypassed and it's only focused on something that's extremely irrelevant. If I was the consultant in either of these scenarios, I would most definitely be consultant number 1 because they are concerned about their consultee. They are there to challenge their consultee to have a higher range of cognitive and critical thinking, but they also push them to be independent while also making them secure in their guidance. And when I have the opportunity to be a consultant one day, I really do hope that that's something I exude. And when I have my soon experience with being a consultee, I'm hoping to have that kind of guidance given to me that I one day want to give to somebody else. Thank you so much for watching.